To discuss the relations of the heart. The heart is present between two lungs, so I have hidden one lung so you could see it more clearly. On superior surface, the heart is related to the arch of aorta and the pulmonary artery. On inferior surface, the heart is related to the diaphragm. On anterior surface, the heart is related to the sternum and the ribs and the costal margins. On posterior surface, the heart is related to the aorta and the esophagus. Here you can see the heart is related to the esophagus, aorta and the bronchus, which are not visible over here. On lateral surfaces, heart is related to both lungs. So let's discuss the anatomy of the heart. Okay, so let's discuss the anatomy of the heart. Here the heart, you can see the heart in 3D. So I will teach the anatomy one by one. Let's discuss the anatomy of the heart. I have isolated the heart so you could clearly learn what are the anatomical structures on the heart. Heart has 4 chambers: right atrium, right ventricle, left atrium and left ventricle. This is a cut section of the heart. So the deoxygenated blood enters through superior vena cava and inferior vena cava into the right atrium, and from right atrium the blood enters through this valve. This is a tricuspid valve. It has 3 cusps. So this cusp is septal cusp, which is attached to the septa, and this is the posterior cusp. Obviously it is present on the posterior side. This one over here is the anterior cusp. These cusps are attached through chordae tendineae to the papillary muscles. So we will also see the papillary muscles. So these are the, here you can see the papillary muscles. This one is papillary muscle, that papillary muscle, 3 set of papillary muscles. There are 3 papillary muscles which are attached to 3 chordae tendineae, which are further attached to the tricuspid valve. From deoxygenated blood enters from tricuspid valve into the right ventricle, and from right ventricle during the systole the ventricle contracts, and due to this contraction the deoxygenated blood enters to this valve here. This valve is the pulmonary valve, and through this valve enters into the pulmonary arteries. These are the pulmonary arteries which carry deoxygenated blood to the lungs, and after the deoxygenation the blood enters from the lungs through these pulmonary veins. There are 4 pulmonary veins which enter into the left atrium, and from left atrium the oxygenated blood enters to this valve, and this valve is known as mitral valve. It has 2 cusps, so it is bicuspid valve, and likewise it is also attached to the chordae tendineae, which are further attached to the papillary muscles, so which basically helps to close it during the systole, so to prevent the backflow of the blood into the left atrium. And the oxygenated blood then enters through this valve. I hope you can see there. This is the aortic valve into the aorta, and from aorta to the body. Aorta has ascending aorta, the arch of aorta, and a descending aorta. The ascending from the arch of aorta, 3 vessels arises, which are brachiocephalic, subclavian, and left common carotid. So this is all you need to know about the anatomy, and let's discuss a few more things. This is the posterior interventricular sulcus, and this is the interventricular septum, basically, which separates the 2 ventricles. It has a muscular part and it is a membranous part. And let's talk about the arteries which supply the heart. There is a left coronary artery and the right coronary artery arises from the aorta. This is the right coronary artery which I have highlighted. This supplies the right side of the heart, and it gives a branch which is known as the marginal branch, and it also gives the posterior interventricular branch or posterior descending branch. Alright, and let's discuss about the left coronary artery. The left coronary artery also arises from the aorta, and it divides into 2 branches. One is the left anterior descending branch, and the second one is the left circumflex branch. And the deoxygenated blood from the heart is collected into this coronary sinus, which drains into the left atrium, and here is the opening of the coronary sinus. So these are all the important points, and this is the SA node, this is the AV node, and obviously they form left and right bundle branches. Yeah, so I hope I hope this video, if you really liked our work, then please subscribe to our channel, and we will make further content like this. Thank you.